Close to nature is close to your world. Myron Homes, Cherubic Farms at Chevilla, 7799
Today is a very important day and with a historical significance. Though we have joined, Ramesh Hospitals in Andhra Pradesh and Aster Healthcare, which is an internationally reputed healthcare organization. Though there are, like differences, like they are international players, and whereas we are in rural India. So when we started practice almost in Andhra Pradesh, there was nothing here. And since 1996, we slowly established certain advanced technology. So after joining, we tried to understand each other, and we could see that there are a lot of synergies between us. In fact, their Calicut Aster Hospital was the first institute in entire India to be accredited with the NABH. Now, whatever the number of hospitals they have in GCC or India, and our hospitals in Andhra cluster, all are either NABH accredited or JCI accredited. So that really means that we are both concerned with the patient quality. That is the topmost priority, and that is the reason for our quest for quality and accreditation processes. Also, we are interested, or we look at the quality care and cost effective with most advanced technology, certain equipment which we have almost first in our country. And apart from that, we thought our synergies can be utilized if the human resources, they have certain very senior most people in Bangalore and Kochi in certain departments like oncology, neurology, neurosurgery, laparoscopic, robotic surgeries and all. So we have been trying to synergize these resources, technology, and also the academic front. We have DNB program, and they have Dr. Mopin's Medical College in Waynard, which is very highly quality-oriented and excellent academic institute. So, and also we have research units where we have been conducting research in India for almost 15 years now. So we want to collaborate in areas where all our synergies can be utilized to bring in the best care to the people. We have been into rural India. In fact, in 1988, when we started in Andhra Pradesh, there was nothing here, and almost even the ventilator was not there at that time. So we started Cath Lab in 1996, which was the first lab from Calcutta to Chennai in the entire East Coast. And after that, we have acquired a lot of advanced machinery to have multi-speciality departments. Now, with all these things, apart from that, we have been always passionate about golden hour treatment. Especially my passion and my team's passion has been critical care in rural areas, villages and mandals. And in the golden hour, you know that the 80% of the deaths can be prevented if proper care is given in the first 60 minutes. So that is the importance, and we have realized it, and for almost 20 years, we have installed ECG machines and all in different places. We are connecting to different hospitals also. Now with the advent of telemedicine, which we are the pioneers in the state of Andhra Pradesh for almost 11 years, we have been offering, we have offered several telemedicine services to several lakhs of patients. Also recently, we have introduced Cloud Docs Ramesh, which is a tele-ICU methodology which is not practiced in many places in the globe. We can connect to any other hospital. As a pilot, we studied in our own hospital group, and 24 hours our doctor will monitor the patients. All over the world now it is realized that tele-ICU can bring down the mortality by 40%. So alerting in the first few minutes of impending arrest, you can prevent many deaths, you can reduce the costs, you can reduce the morbidity. So this is one area where we can leverage our services, and across the group in the academic program front also, we want to bring all the departments on one platform across the country and see that the best is offered to the patients and also the training programs. So with all these things, now we thought, yes, we were exploring. For quite some time, we have been discussing about further expansion programs and how best we can leverage our experience and the technology and the systems in place to bring best quality to the areas, to the area of Andhra Pradesh. So we hope in the next decade or so, we will be almost equivalent to any other best international institute, the Andhra area. We want to connect it through our tele-ICU, telemedicine systems also to reach every nook and corner of Andhra Pradesh. So I thank Dr. Mopen and his senior management team and initially for trusting us when they joined in 2016. Hope everything will go well and still we become stronger in this area and with the synergies and all strengths which we have.
This is an experience for me. I'm sure that you will be meeting Dr. Ramesh Babu and others quite frequently. This is my first opportunity to address a media, and I'm extremely happy that this is happening to reiterate our commitment to the Ramesh Hospitals as well as to the people of Andhra Pradesh. Aster being a brand which has been mentioned as by Dr. Ramesh Babu, it is known across India and outside India. We also had our beginning in India. I'm a medical doctor who started as a teacher in the medical college in Calicut, then went to outside India, then started some facilities there, then came back. And we have now 17 hospitals in India, in 5 states. And we have about 4,500 beds in India, one among the largest. And we have about, altogether, 8,000 odd doctors, 4,000 odd doctors and 8,000 odd nurses across India and GCC, and large part of that is in India. So, and we are a listed company in India. We are one of the listed companies. We got listed in 2018. Our commitment to Dr. Ramesh Babu and the state of Andhra is that we will be there to bring advanced tertiary quaternary care, which requires 1, the expertise, 2, the resources, both people as well as money, and we are ready to commit that. So as we go forward, apart from whatever we have now, we would like to see how this can be expanded further. We know that there are a lot of patients from Andhra Pradesh now going out for some of the advanced treatments. We have to stop that. That's very important. No state should be forced to send their patients outside the state. I know that the Telangana and Andhra were together and Hyderabad was the capital, and so there's a natural tendency to go to Hyderabad for people here. But that's past. The present is that we have to have this facility here. So we are duty bound to bring that, and we have the capabilities because we have been doing this across India, especially in our hospitals in Kerala, where we have large number of hospitals, in Karnataka, where we have large hospitals in Bangalore, as well as in other places. So we have the people who are required for that and also the resources for that. We are discussing with Dr. Ramesh Babu how to go forward, what are the other things to do, apart from developing the existing hospitals and improving its facilities. We also have a chain of pharmacies and labs, which naturally will be coming into this state. We want to roll it out across the state. Already there are few, but we would like to do that. Devan has been here for a long period, and he has been working along with the Dr. Ramesh Babu and the team. And now Dr. Nitish as well as others also will get involved. So I just want to once again thank you for the support that you have given to Ramesh Hospitals and now the Aster Ramesh Hospitals. We want to make it into a destination for not only for people in the state, but also for people from outside to come here. That's what is happening in many places. If you look at Kochi, where we have a large hospital, or Bangalore, where we have a large hospital. We don't have a large hospital in Hyderabad, but Hyderabad also, lot of patients come from outside the state, outside the country to these places. So why not? We should look at ways in which we can do that. So let us see how we can increase, improve, and strengthen the present facilities and take it to the next level. Thank you very much. May God bless. Jai Hind.
ఇప్పుడు వాళ్ళకి ఇంటర్నేషనల్ ప్లేయర్ అండ్ హెల్త్ కేర్ సిస్టంలో ఎప్పటి నుంచో ఉన్న సిస్టమ్స్ అవన్నీ తీసుకుని మనం ఈ గత 7 సంవత్సరాల్లో కూడా చాలా మటుకు మనం ఇంప్రూవ్ చేయగలిగాము. ఇక్కడ జేసీఐ కానీ లేకపోతే ఎన్ఏబిహెచ్ కానీ ఇట్లాంటి క్వాలిటీగా ఇవి. సో ఇంకా ఫర్దర్గా ప్రోగ్రెస్ అవ్వడానికి మా కమిట్మెంట్ ఇద్దరం కలిసి ఈ ఏరియాలో ఇట్ ఈస్ నాట్ జస్ట్ ది నెంబర్ ఆఫ్ బెడ్స్ ఏదో ఎక్స్పాన్షను అదొకటే కాదు. బేసిక్గా హౌ బెస్ట్ వీ కెన్ గివ్ the quality treatment at affordable cost. That is what we have been discussing, the senior managements have been discussing. Almost every segment, ఇక్కడ కొన్ని మాకు ఇప్పుడు ఆరోగ్యశ్రీ హాస్పిటల్స్ కూడా ఉన్నాయి. అట్లాగే ప్రతి సెగ్మెంట్కి కూడా మనం బెస్ట్ క్వాలిటీ ఎట్లా ఇవ్వాలి అనేది అట్లాగే అనుసంధానం చేసి మనకి అక్కడ ఉండేటటువంటి ఎడ్యుకేషన్, అకాడమిక్స్, కన్సల్టెంట్స్, వీళ్ళు చాలా సీనియర్ పీపుల్ ఉన్నారు. అందరితో కలిసి వీ కెన్ హ్యావ్ సమ్ సార్ట్ ఆఫ్ అకాడమిక్ ప్లాట్ఫామ్ ఆల్సో. సో ఈ మధ్యనే మెడికల్ అడ్వైజరీ బోర్డు మీటింగ్ జరిగింది. సో వేర్ ఆల్ డాక్టర్స్ ఫ్రమ్ సీనియర్ డాక్టర్స్ ఫ్రమ్ కోచి, హైదరాబాద్, కర్ణాటక, అలాగే మేము కూడా వెళ్ళాము. సో అక్కడ అందరం కలిసి ఎస్ వీ హ్యావ్ టు ఫార్మ్ ఏ టీమ్ అండ్ అక్కడి నుంచి మనం మంచి బెస్ట్ సర్వీస్. నౌ టెలిమెడిసిన్ హెస్ బికమ్ వెరీ ఇంపార్టెంట్ ఏరియా కాబట్టి సో అట్లా మేము అంటే నాట్ ఓన్లీ దిస్ వీ హ్యావ్ బిన్ డిస్కసింగ్ అబౌట్ దిస్ డ్యూరింగ్ రెగ్యులర్ మీటింగ్స్ ఆల్సో. సో వీఆర్ కమింగ్ అవుట్ విత్ ఏ గ్రేట్ ఐడియా ఆఫ్ ప్రొవైడింగ్ ద బెస్ట్ క్వాలిటీ కేర్ in more or less some sort of a rural India టైప్లో, అంటే అన్ని మండల్స్ వాటిల్లో కూడా మేము చేస్తున్నాం అనమాట. సో ఈ రకంగా కలిసి ముందుకెళ్తే బెస్ట్ ఇవ్వాలి. అలాగే హైదరాబాద్ ఇప్పటివరకు నేను 25 years బ్యాక్ కూడా స్టార్ట్ చేసినప్పుడు మై మెయిన్ ఎయిమ్ ఈజ్ టు స్టాప్ people going to Hyderabad. That was the reason why I started Cath Lab in 1996. అయితే it took lot of time. తర్వాత కూడా ఇప్పుడు చాలా మంచి హాస్పిటల్స్ వచ్చినాయి అక్రాస్ ది స్టేట్ కూడా 96 తర్వాత కూడా. సో మెజారిటీ ఆఫ్ ది పీపుల్, ఆల్మోస్ట్ ఐ వుడ్ సే 70% ఆఫ్ ది పీపుల్ హ్యావ్ స్టాప్డ్ గోయింగ్ టు హైదరాబాద్. అయితే స్టిల్ 30% ఇంకా వెళ్తున్నారు. సో అవి కూడా వెళ్ళాల్సిన అవసరం లేదు. ఇట్ లాట్ ఆఫ్ ట్రావెల్ ఎక్స్పెండిచర్ అన్నీ అవుతుంది. అందువల్ల అది చేయడము, అదే కాకుండా ఇంకా అసలు వీ హ్యావ్ టు బ్రింగ్ పీపుల్ ఫ్రమ్ అదర్ ప్లేసెస్ ఆల్సో. ఇఫ్ యూ హ్యావ్ ఎ వెరీ గుడ్ హాస్పిటల్ విత్ ఎక్స్పర్టైజ్ అండ్ మంచి టెక్నాలజీ అండ్ మంచి కేర్, ట్రాన్స్పరెన్సీ, ఇవన్నీ ఇస్తాం కాబట్టి మేము వీ థాట్ ఇన్ ద మార్నింగ్ ఆల్సో వీ హ్యాడ్ ఎ డిస్కషన్, వీ విల్ గివ్ ది బెస్ట్ కేర్ టు దీస్ పీపుల్ ఆఫ్ దిస్ ఏరియా సో దట్ ఇట్ విల్ నాట్ బి సెకండ్ టు ఎనీ అదర్ ప్లేస్ లైక్ హైదరాబాద్, చెన్నై, ఎక్కడికి వెళ్ళాల్సిన అవసరం లేకుండా చేయాలి అని చెప్పి.
Of their hard work to bring this organization to at this level. So it is not just the co-branding of this Ramesh Hospital of between Aster and Ramesh. It's kind of aligning the vision of two great visionaries, and that responsibility lies with my team here to ensure their vision is fulfilled in next 5 years. On behalf of my team, I would like to, in this forum, like to assure Dr. Azad Mupen, Dr. Ramesh Babu, we will ensure that from the Aster side, we will be the number one in South India in next 5 years. Not in terms of only beds, we are talking about being one of the highest quality healthcare deliver. In the quaternary care space, we will be known for that. That is our promise in next 5 years. And your vision, Dr. Ramesh, of making Ramesh Hospital, Aster Ramesh Hospital, a destination in Andhra, for not only for 4 crore population of 5 crore population of Andhra also, but it's also for the Telangana and northeast, eastern part of India and across India, if possible. And then also we would like to focus on getting international patients to Vijayawada. That's our vision. We want to double the number of beds what we have here in the next 5 years, if possible more. That's a commitment we have taken, and that is a commitment not only to internally, but into the commitment to the people who are part of the ecosystem here, including the media people. We want you to carry this message that Aster Ramesh Hospital is here to serve the people of Andhra Pradesh primarily, and if possible, the people of India. I hope that you continue giving this excellent support what you have been providing, and hope for the bright future for our organization and people of Andhra. Thank you very much.